Do you have pain in your glutes when you are sitting, lying down on your back, walking, or using stairs? If so, you may have what you call a gluteal tendinopathy, and in this video I'm going to go over some exercises to help you treat gluteal tendinopathy, so stick around. Hey, how's it going? This is Saman here from All Things PT, and in this video we'll talk about gluteal tendinopathy. Before we begin, let's talk what is a tendinopathy. Tendinopathy is basically an inflammation of a tendon, and tendon is what connects the muscles to the bone. The most common cause of tendinopathy is a sudden change in volume or intensity of your training. It can also happen if you are not warming up properly before your exercises, or if you're training with a faulty technique. With gluteal tendinopathy, it is a tendon dysfunction of the glutes. In this case, either it could be a glute med or glute max. Let's find out if you have a glute med or glute max tendinopathy. Typically, if you have a glute max tendinopathy, your pain in the glutes are going to increase if you sit down for long periods of time or lie down on your back for long periods of time. You can also provoke the familiar pain by pulling the knees towards your chest, as well as when you lie down on your stomach and lift that affected leg up like this. In case of glute med tendinopathy, you'll be able to provoke your familiar pain by doing a single leg activities such as walking and using stairs. You can also try standing on one leg. Normally, you should be able to stand straight without any shift in the pelvis. However, if you have a glute med tendinopathy, standing on the affected hip provokes your familiar pain, as well as you will have difficulty maintaining a neutral pelvis when you stand on one leg. To confirm, go ahead and lie down on your side with the affected hip on top. Bend both your knees, then straighten your top leg and bring it back. Then bend your knees and internally rotate your thigh bone so that your heels are facing towards the ceiling and are higher than your hip. Now, there are cases when you may have both glute max tendinopathy and glute med tendinopathy. In this case, you may have all the signs and symptoms, as well as all the special tests that we just did is going to be positive. Typically, with the gluteal tendinopathy, you are only going to have symptoms on either your right side or left side. Also, if your pain increases or decreases when you bend or extend your spine, or if you have radiating symptoms starting from your butt and shoots towards your legs, then you may have what you call a lumbar radiculopathy. This video is not going to cover lumbar radiculopathy, but I will make a separate video in the future that goes over exercises that you could do to help yourself treat lumbar radiculopathy. The exercise shown in this video is going to work if you have glute max or glute med tendinopathy, but I'm going to highlight which muscle it focuses on more so that you can pick and choose based on your symptoms. Also note that these exercises build up on one another. Basically what that means is the exercise that is shown first should be done first. Do not progress to the next exercise until you're able to do the previous exercise without pain. Start the exercises with one set of 8 to 10 reps. Then as your body becomes tolerant to them, increase to 2 sets of 8 to 10 reps. Make sure you hold 3 seconds in each rep. Hopefully this video helped. If it did, please make sure you click the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.